These are all diseases that are untreated in large part because our medical system and our public health system refuses to treat them as the illnesses that they are.
At a National Press Club news conference Thursday, Patrick Kennedy, the son of late Senator Edward Kennedy, declared his dedication to helping those fighting drug addiction and mental illnesses.
We have a different calculus apply in government spending or insurance coverage when it comes to these illnesses that would never be permitted if it were any other physical illness. They demand that we who suffer from mental illness and addiction show that intervening in our illnesses has a cost-benefit ratio.
Former Congressman Patrick Kennedy says while he's leading the charge to have health insurers cover mental health the same as physical health, Congress needs to put more resources behind treatment for such illnesses.
And so the real challenge is we have an obligation as a nation to put the resources behind those suffering from these illnesses. And tragically, we would never allow this if it were any other physical illness. If it were any other physical illness, we wouldn't ask what is the cost-benefit ratio. We'd just spend the money.
Kennedy, who has spoken about his own addiction to problems with alcohol and drugs, says now is the time for a political movement to help the millions of Americans who face the same problems he has.
We need to take this 2016 campaign as an opportunity to make sure mental illnesses and addiction are no longer ignored.
Kennedy, who was in Washington in early October for a major rally against addiction, is out speaking about his new book, Common Struggle.
And so I make the connection between my own family's code of silence around these issues. You know, we in my family were not exempt from feeling the public pressure, the fact that we were suffering from these illnesses too.
Kennedy has set up the Kennedy Health Forum to provide a platform for addressing addiction and mental health. In Washington for UPI, I'm Angela Barnes.